Kathy Harkey says she understood the meaning of helplessness as she watched her son Joshua struggle with schizophrenia, a disorder which ended in his suicide.
He felt like, I'm doing fine now, I've taken my medication, I'm doing great. So that's when he quit taking it.
That's when she learned that a mentally ill person who no longer recognizes his or her illness, yet poses no physical threat, can no longer be held against their will. In the state of Virginia, where the law is most lenient, such a person must be released within just 6 hours.
Doors were slammed in my face every which way I turned because family members basically have no rights.
Legal protections against forced confinement partly explain why so many seriously ill people who go unmedicated now live on America's streets. But there's another factor, a historic shift in mental health policy that's been ongoing since the 1960s. This was how public mental hospitals used to be portrayed, as enlightened and humane.
Men and women all gathered together in a modern mental institution, a city in itself, complete with every facility for effective treatment.
However accurate that description, the U.S. today has the same ratio of psychiatric beds to population as it did back in the mid-19th century. From more than 500,000 beds in 1960, there were only 35,000 in 2012. This state psychiatric hospital is one of hundreds across the U.S. that are no longer in operation. Many seriously ill patients of the kind that used to be served by these hospitals must now turn to a network of community mental health centers for their medical, housing, and other needs. But after $4 billion in mental health budget cuts since the Great Recession, those centers are short of psychiatrists, and many critics say they are just unsuited to the task.
They really don't handle people, who think the FBI is talking through their teeth. You can throw all the money in the world at those centers. It is not going to take care of a population that is severely ill.
Making matters worse, most private facilities with available beds won't accept patients without medical insurance. In the wake of a young deranged gunman's murder of 26 Connecticut schoolchildren and educators in 2012, many states have begun to restore money for mental health services. But those fighting for fundamental changes say society must still learn to deal with illnesses of the mind as directly as it does with any physical injury. Tom Ackerman, Al Jazeera, Richmond, Virginia.